How is psychogenic Parkinsonism diagnosed? Have you ever wondered how doctors determine if someone has psychogenic Parkinsonism? This condition mimics the symptoms of Parkinson's disease but is rooted in psychological factors rather than neurological damage. The journey to diagnosis involves several steps that combine clinical evaluation, exclusion of other conditions, and sometimes specific tests. To start, psychogenic Parkinsonism is characterized by symptoms like tremors, rigidity, and bradykinesia, which is a slowness of movement. These symptoms can be quite similar to those seen in Parkinson's disease, but they arise from psychological distress rather than physical degeneration. The first step in diagnosing this condition is a thorough clinical evaluation. Doctors will assess the presence of Parkinsonian symptoms, looking for signs like bradykinesia, tremors, rigidity, and postural instability. This evaluation is crucial in understanding the patient's condition. Next, it is essential to rule out organic causes of Parkinsonism. This means doctors will conduct tests such as dopamine transporter single photon emission computed tomography scans. These scans are typically abnormal in Parkinson's disease but usually show normal results in psychogenic Parkinsonism. This distinction is vital for accurate diagnosis. Another important aspect of the diagnostic process is the use of specific criteria. The Fawn and Williams criteria help identify functional movement disorders, including psychogenic Parkinsonism. These criteria focus on the presence of inconsistent or variable symptoms, which do not align with typical organic Parkinsonism. Given the psychological nature of psychogenic Parkinsonism, a comprehensive psychological assessment is also necessary. This evaluation helps identify any underlying psychiatric issues that may contribute to the symptoms. An interesting point to note is that psychogenic Parkinsonism does not typically respond to dopaminergic therapy, which is a key treatment for Parkinson's disease. This lack of response can serve as a supportive criterion for diagnosing psychogenic Parkinsonism. Differentiating psychogenic Parkinsonism from other conditions is crucial. Doctors must consider other potential causes, such as drug-induced Parkinsonism or other neurodegenerative disorders, to ensure an accurate diagnosis. In summary, diagnosing psychogenic Parkinsonism requires careful clinical assessment, exclusion of organic causes, and consideration of psychological factors. It is a complex condition that benefits from a multidisciplinary approach to ensure accurate diagnosis and effective management. If you or someone you know is experiencing symptoms, it is essential to consult healthcare professionals for personalized advice and support.